Following the infrastructural decay in Nigeria's health sector and the subsequent motion on the need to declare a state of emergency on the nation's health sector, the House of Representatives has reaffirmed its commitment towards ensuring that the health sector is revived and made to tackle emerging health challenges. The chairman of the House of Representatives Committee on Health Institutions, Honorable Amos Gwamna Magaji, gave the assurance during a public hearing and submission of memoranda by stakeholders in the health sector on the need to declare a state of emergency on the health sector, as well as a bill for the establishment of a federal medical center in Kafanchan, Southern Kaduna, among others. The committee chairman, Honorable Amos Gwamna, and other members of the committee identified some challenges bedeviling the sector, including brain drain of Nigerian health workers, poor budgetary allocation for healthcare institutions, lack of adequate equipment, and poor remuneration for health workers, among others.
The committee chairman, Honorable Gwamna, and other members of the committee identified some challenges bedeviling the sector, including brain drain of Nigerian health workers, poor budgetary allocation for healthcare institutions, lack of adequate equipment, and poor remuneration for health workers, among others. The committee chairman also stressed the importance of establishing Federal Medical Center in Kafanchan, noting that it will help address the shortage of adequate federal government health facilities in southern Kaduna. He, however, assured Nigerians and other stakeholders that the House will collaborate with the executive to ensure that the right thing is done to revive the health sector and make it functional.
A lot still needs to be done. We are going somewhere to happen. We are not where we used to be, but certainly we are not where we ought to be. But with this commitment that you have demonstrated these 2 days, that some of you have waited, sat in one seat for hours, that probably some of you have not done for days, for months, for weeks. I can see that all of us here are committed to seeing that the health sector in Nigeria moves forward. And I can declare it to you here that one of the legislative agenda of the 10th Assembly is also key, the transformation of health. So in this divide, we are also committed to seeing that health is given her due priority. I want to use this period to thank Mr. President for the first time, even when you look at the budget for health, there has been the proposal that was sent to National Assembly. You can see that there is a deliberate attempt to give more attention to health.
Speaking in an interview with newsmen shortly after the public hearing, the national president of Nigeria Medical Association, Professor Bala Mohammed Audu, said the public hearing will go a long way in enabling stakeholders to make proper input on the way forward for the nation's health sector and how best to tackle the challenges.
Our visit is mainly to support the motion on declaring the state of emergency in health, which is aimed at ensuring that Nigerians have quality healthcare delivery and access to quality healthcare delivery. We believe it will because of the seriousness of the matter and because of the way stakeholders have all bought into it and the seriousness with which the House of Representatives Committee, House Committee on Health Institutions have taken the matter. The discussions have been very full of a lot of debates, full of a lot of pros and cons, and we believe by the time the committee sits and filters out all the contributions that have been made, that a lot of significant progress will be made.
The committee is expected to submit its recommendation to the House within the coming days. In Abuja, I am Ahmed reporting.
The federal government has directed all vice chancellors in federal universities